Good afternoon. It's the little things, like morning or afternoon, that we have to. I think most of the people know the people here today. From my far right, Linda Lacewell, Superintendent of the New York Department of Financial Services, and also on the Emergency Management Task Force that is handling this. The good Dr. Zucker, Melissa DeRosa, Secretary of the Governor, Beth Garvey, who is the special counsel to me. Let's give you an update on COVID-19. These are the new numbers. Westchester County is up 10. New York City is up 17. Nassau 2 and Rockland 2. As we've said, keep in mind what we're doing here. These test cases are not representing a random sample. They are not statistically accurate to the growth of the spread of the disease, because this is a selective sampling. We are primarily sampling people who are associated with people who test positive, right? People look at these numbers as almost a statistical representative sample of what's happening. That's not what this is. These are positive cases tested primarily from a universe of people connected with someone who tested positive. What they do show is a continuing problem in Westchester County. And it's not Westchester County, it's New Rochelle. New Rochelle at this point is probably the largest cluster in the United States of these cases. And it is a significant issue for us that we'll speak about in a moment. You can see even New Rochelle compared to New York City. That 108 in Westchester, you may as well say New Rochelle. So New Rochelle's at 108, New York City is at 36. I mean, that is really breathtaking. Again, putting things in focus, Washington State is at 179, New York at 173. You see how much higher the deaths are in Washington? That makes the point that we've been talking about, who will be most likely affected by this situation. And Washington State, it was in a senior citizen home. And that's what this is all about. That's what this is all about. What does it mean? What does it mean? What is the bottom line? Senior citizens, people who are in the vulnerable population, senior citizens, underlying illness, compromised immune system, that's who we're trying to protect here. And you see that in the 22 deaths in Washington compared to New York with no deaths, right? Same number of cases, look how much higher Washington is, because it's about the senior citizens. And our focus governmentally, nursing homes, senior citizen congregate living, our focus on an individual level, senior citizens, compromised immune systems. Again, what is the net effect of the disease? People talk about it like it's the Ebola virus, which was really a serious and frightening virus. We have 173 cases, only 14 people are in the hospital. Well, how can that be? Because people are at home recovering from flu-like symptoms. 14 out of 173. If you look at the 14, most of the 14 are members of that vulnerable community. Again, you want to put this all in perspective? The single best way to put it in perspective is the Johns Hopkins tally, which has tallied all of the cases since China. 114,000 cases. That's China, that's South Korea, that's Italy, that's the United States. 4,000 deaths, again in the vulnerable population. 64,000 people recovered. 46,000 cases still pending, people getting treatment or people at home. That's the entirety of the universe. New Rochelle is a particular problem. It is what they call a cluster. The numbers have been going up. The numbers continue to go up. The numbers are going up unabated. And we do need a special public health strategy for New Rochelle. What we are going to do is focus on an area, concentric circle, around the situs of the majority of the cases in New Rochelle. Much of the transmission tends to happen on a geographic basis. Kids go to school, kids go to a store, parents go to a store, parents walk down the block, shake hands with someone, parent is walking the dog, meets somebody, says hello, has a conversation. Remember how this spreads. It can spread from it's a respiratory illness, droplets of a sneeze, a cough, it's on somebody's hand, you shake hands, now you have an issue. So containment strategies focus on geographic areas. Commissioner Zucker has been working on this. This is the single greatest public health challenge we have in the state right now. And coming up with a special strategy to deal with this has been his focus. He has recommended a plan to me. I have accepted the plan, which will deal with this containment area, and the commissioner will speak to it in a moment. One of the things we're doing is we're putting a satellite testing facility from Northwell into New Rochelle. So they will set up a facility within that containment area that can do testing. Northwell received approval last night for their automated testing capacity, which increases Northwell's capacity to test. We had been waiting for the CDC to do that. The CDC approved that. Northwell will open up a temporary satellite facility so they can do testing right in that area. Even testing is a problem, right? Somebody gets in a cab to go to the hospital. Now you possibly affect the cab driver. Somebody gets on a bus. Now the person is on a bus. So this is a major advantage. We're also going to use the National Guard in the containment area to deliver food to homes, to help with the cleaning of public spaces. There is a debate about how long the virus can live on hard surfaces, and you have differing opinions now. Some opinions are the virus can live on a hard surface such as stainless steel or plastic for 2 days or more. If that's the case, that would be a significant issue as to why it is transmitting the way it does. So cleaning those surfaces is very important, cleaning it with the right material, and the National Guard will be helpful on that. With that, let me turn it over to Dr. Zucker to talk about the strategy for New Rochelle.
Thank you, Governor. So as we know, this is an evolving situation, and we're addressing many different points as we move forward on this. We have spoken before about the issues of containment, and we have moved from a containment strategy to more of a mitigation strategy. When you're dealing with mitigation, you have to deal with the issues of some social distancing and how people gather together and to try to minimize that. And one of the places where people gather together, particularly, is the school systems and schools and other areas, events and daily or weekly activities. And we believe that the most important thing from a public health standpoint is to minimize that. We know where the sort of the center of the activity has occurred from the information of public health and the epidemiology investigation from the beginning of the Westchester and New Rochelle outbreak, and we felt that a radius of a mile from that spot would be effective in an effort to try to decrease the spread. I spoke to some of the public health experts the other day and also this morning, all the time I should say, about this issue. And we have to remember that we are sitting with the first point on a curve, or first couple points on a curve. And it would be wonderful to be able to go in the future and look back and see how this curve is going to evolve. But we don't know that. And so the most important thing to do is to take all the precautions we can and balance that from a level of protection with that of what could be somewhat disruptive, and we understand some things will be disruptive. So we're moving forward with that and happy afterwards to discuss it further.
Okay, I want to thank Dr. Zucker for that. The doctor's plan is March, the period would be from
March 12th, starting this Thursday.
March 12th from this Thursday, a 2-week period where facilities within that area, schools within that area would be closed for 2 weeks. We'll go in, we'll clean the schools, and assess the situation. This will be a period of disruption for the local community. I understand that. Local shop owners don't like the disruption. Nobody does. Local politicians don't like the disruption. I get it. This can't be a political decision. This is a public health decision. It's not a decision that I'm making. I'm accepting the recommendation of Dr. Zucker. In a situation like this, whether you're president, the mayor, the governor, let the experts decide and let the science drive the decision. When you politically interfere in science, that's when you tend to make a mistake. So again, the period is March 12th through the 25th. 1 mile is a fairly constrained area. It is a dramatic action, but it is the largest cluster in the country. And this is literally a matter of life and death. That's not a overly rhetorical statement. A couple of other facts. I've asked the controller of New York, Tom DiNapoli, to give me an opinion as to what consequences he might think this economic shutdown and the entire coronavirus situation will have on the state budget. As you know, we're ready to do the state budget. The state budget anticipates this year's revenues and projects next year's revenues. You have what's going on in the stock market. You also have what's going on the economy overall, right? Conventions are being stopped, tourism is down, hotel bookings are down, restaurants are down. So we just did the budget projection estimates. The world then changed since then, so I asked him for any advice that he might have. As I mentioned earlier, there are different opinions on how long the virus can live on hard surfaces. So much of this is new and evolving. No one really knows for sure, so you tend to get different opinions. And the doctor is talking to people all day long. I'm talking to people all day long. There is an emerging school of thought that says the virus can live longer on hard surfaces than originally anticipated. Could live 2 days, maybe even a little bit more. I'm asking all the public transportation authorities in the state to redouble their cleaning efforts. It's easy enough to clean. It's a question of bleach or another cleaner that's approved by the EPA that kills viruses. But if it is 2 days on a hard surface, a bus, et cetera, just pictures people are walking around, that is a different situation. And I want to make sure that the cleaning protocols are up to date. Again, as a point of clarity, the state put out a regulation yesterday. Any school that has a child that tests positive must close immediately for 24 hours. That 24-hour period is only a period to allow assessment of the situation, to determine what the remedial course is, right? So it's not, it must close for a day, and then it's going to open the next day. It must close, then you do an assessment, then you determine what to do with the school. And that will be done on a school-by-school basis because the facts change. And I think that's it. One other point of clarification. You cannot joke. Do not joke. Whenever you joke, you get in trouble. Hand sanitizer that we presented yesterday, the state is not making a profit from the sale of hand sanitizer. The hand sanitizer is not for sale. It is given to other jurisdictions, state use, prison use, bus use. Certain people have commented that it's a for-profit and tawdry, that the state is profiting from the sale. We are not selling the product.